Healthy aging is not just about adding years to life, but adding life to those years. A very warm welcome to everyone joining us today for today's online session. I am Jaisurya, today's host for the session. As we come together to explore the theme of healthy aging, a topic that holds immersive importance as we work toward enhancing the dignity, well-being, and active participation of the older adults in our communities. We are truly honored to have with us an eminent expert in the field of geropsychology, Dr. Nidhi Misra, Associate Professor and Head of the Department of Applied Psychology at Geetham, Deemed to be University, Visakhapatnam. Dr. Misra holds a PhD in geropsychology from the University of Allahabad and has made significant contributions to psychosocial gerontology both nationally and internationally. She serves as a editorial board of the European Journal of Mental Health and is a part of the uh, international advisory team of the Merrier Foundation Canada. Her extensive work span crucial. Sorry, one.
You are muted.
Jai Surya Saab. Jai Surya.
Sir, I am there. I think I am audible.
Jai Surya.
Hello, am I audible?
Excuse me, please. I mean, all participants kindly excuse us. See, there seems to be some kind of technical snag. We are just trying to rectify it. Just allow us some time.
Hello, am I audible?
Yeah, you are, but in between you got disconnected, it seems. So some part of it we couldn't hear. Yeah.
Ma'am, I was in that Merrier Foundation Canada. Am I?
Yes, that is fine.
Yes.
That is.
Yeah. Okay. So, Dr. Mistra's extensive work spans crucial domains including health and well-being, environmental psychology, identity, and collective experiences and inclusive education. A notable highlight of her career is her contribution to the United Nations Population Fund project focused on strengthening knowledge on aging in India. She also had the honor of representing India in 2013 at the United States International Program on Policy Formulation and Monitoring of the Madrid International Plan of Action on Aging, held at Malta. With her powerful combination of academic depth, research excellence, and initiatives such as Senior Express, a platform promoting active aging, Dr. Misra continues to inspire meaningful change in the lives of older adults. Ladies and gentlemen, it is my pleasure to welcome Dr. Nidhi Misra to lead us into today's insightful session. Ma'am, we are excited to hear from you and learn through your expertise. Thank you.
Thank you very much. Namaskar, everyone. I am glad that I'm here with you to talk about healthy aging and which you are actually living right now. But I'll just give few inputs from my experiences of working in this area for the past 15 years. I'll be just sharing my PPT here.
Healthy aging.
Yes. I hope the PPT is visible to everyone here.
Yeah.
Yes, it is visible.
It is visible now.
Yeah, thank you very much. So, the topic of my talk today is about healthy aging in a changing world. And here as I mentioned, I'll be sharing some inputs about the UN Decade of Healthy Aging, which is exclusively focusing on promotion of healthy aging. And I'll be also sharing some more information about this based on my 15 plus years of experience in this field. So to start with, let's understand why am I focusing on this topic? Because as we all are seeing, and you must be listening to other talks as well, the there is a change. There's something change is happening at a demographic level. So the world is changing at a very fast pace, and around the world, countries are experiencing the phenomena of population aging. That is, more number of 60 plus people are there, and India is also experiencing a rapid population growth of older adults. And I think this is something which you must be hearing continuously. So I won't spend much time on this, but I'll focus more on what I intend to say here is in terms of the healthy aging. So the World Health Organization basically specifies healthy aging, and it talks about healthy aging is something where the focus is more on maintenance of functional ability. A functional ability is something about the capacity to be active or to do what people wants to do. So why are we focusing on healthy aging right now when often aging has been associated with decline and deterioration? That is something which 10 years, 12 years back I started working on. And when I started my PhD in the area of geropsychology, there were hardly anyone talking about gerontology in India. And even people known to me were telling me that, you know, you are doing this PhD in this area, and you may end up being depressed, frustrated, that you're working in this area. And my focus was that it's not like that. There are many who are aging very positively. There are many who are being very functionally active, and it's also important to highlight those aspects as well. And then I came across the concept of healthy aging put forward by World Health Organization and United Nations. And I started exploring things related to functional ability. That what is functional ability, and I'll be coming to that point. Before that, let's understand why do we need to focus on healthy aging? Because of the longer lifespan, right? There are now, as we see, if I talk to my grandparents, I mean, when I used to talk to my grandparents, they used to tell about things, how their grandparents were different. Now my kids' grandparents will be telling different stories about it. So with the changing world, the phenomena of aging is also changing frequently. And what is there right now, 2 decades ago, it was not there. So now you see more number of people are not only just living longer, they are also living active and positively. And that's something which actually also encouraged me to start my own initiative in the area of healthy and productive aging. And it was named as Senior Express. I was running this venture, and it was about sharing stories on positive aging in India, because mostly aging is being so positive aging or healthy aging is associated with something to do with the Western world. And I used to say 10 years back that in India we have so many such examples. So why it is becoming so important? Because of longer lifespan, now because of rapid change in terms of digital transformation. And in this picture you can see a grandfather is sitting with a granddaughter and trying to look at the mobile smartphone, and I think that's one of the way of connecting with the generations. And even the health advances, healthcare advance or social shifts in terms of change of family structure, also this is becoming so important. And the well-being is a major importance right now. When I say well-being, and I am a psychologist, well-being is not just about medical health. Well-being has to do a lot with the quality of life and the way people are leading their functional ability these days. So that's the reason it is so important to focus on healthy aging. Now, moving further, another important point I would like to highlight here is the demographic and the social shift. So now, as you see, most of the reports, the UNFPA report or the ministry reports are highlighting this, that by 2050, 1 in 5 Indians will be age 60 or above. And this is a profound demographic transition. And also, it has been projected that in the coming years, by in few years, by mid-century, there will be 320 million older adults in India. So this is a big number, right? And why it is such a, along with these demographic changes, there are a lot of social shifts also happening. And what are these social shifts? There is nuclearization of family. Earlier we used to be in a joint family. Now we are more into the nuclear family. Now there is a geographical mobility also. More number of children are moving to better cities, better countries for a better job prospect. I mean to say that they move for better job prospects or as per their plan and aims, right? And also there is a digital divide. The digital divide is more in terms of both generations. Though the elderly are learning about digitalization, but there is also a kind of disconnect between the generations because still there are a lot of ageism in terms of usage of digital products among senior citizens. This is another topic of discussion, and I do work in this area as well. But that could be taken later. I think right now I'll be focusing more on this particular topic. Now to move ahead, and this is the main crux of my session today. And I have been working on this topic of UN Decade of Healthy Aging with my colleagues in different parts of the world, Russia, Canada, Poland, and Singapore. So I'm working with my colleagues in this area. My research basically focuses on how the UN Decade, United Nations Decade of Healthy Aging, is promoting better health or better quality of life for senior citizens across the world. And this particular UN Decade of Healthy Aging is talking about a global framework, and it emphasizes that the government, civil societies, communities should come together to focus on four interconnected action areas. And these action areas are listed here, as you can see. This is combating ageism. Ageism is something, any kind of discrimination or stereotype against age exclusively related to older adults, and which is stopping them from getting some opportunities or leading a dignified life. I worked on second careers as well with one of the leading organization in India, which were working with senior citizens, and I saw so many examples of ageism there, where the employers were not willing to give job to somebody who is 50 plus and 60 plus as compared to somebody who is 20 or 30, despite of the fact that the 50 and the 60 are much more active than the 20 and the 30-year-old. So that was an example of ageism for me. And also the second action area is the age-friendly environment. That is creating communities that support autonomy, health, and providing kind of environment, which is not just here when I'm saying environment, it is not just physical environment, but it is the psychosocial environment as well. So what UN says that we should provide a kind of environment where the seniors should feel accepted and wanted, not just from the physical point of view, but psychosocial point of view as well. And then is the integrated care. Integrated care is focusing more on the person-centered healthcare, and where the focus is more on provision of holistic healthcare, not just medical care. And the fourth action area is long-term care. Here, the focus is on development of some sustainable systems, where the focus is on because many seniors are living in long-term care, assisted living facilities. How we can ensure that they are leading a dignified, autonomous life with a quality support. That is the fourth area where the UN wants the member countries to work on. Now let's look into it in detail. What can be done in terms of these action areas and what is happening in terms of these action areas. So in terms of combating or stopping ageism, we all see that there are a lot many things which are persisting in the society. Like the youngsters may tell a senior that you wouldn't understand, or a healthcare setting may just dismiss the treatment, or from a policy point of view, they might be excluded from the economic participation. So these are some examples of ageism. And the hidden costs are many for our senior citizens, like diminished confidence and self-worth, or a internalized stereotype, or a reduced longevity, or even loss of economic and social contributions. And so many times these ageisms, these kind of treatment by the society are making seniors have that kind of low self-esteem and low confidence, and they are like no often they often think that I'm not of any use, or why should I get into certain things. So they are the older adults are resources basically, and they are not dependents. This is what the UN Decade of Healthy Aging talking about. Even my, as Jayasuriya was mentioning about me being selected for this made an international plan of action on aging training program in Malta, and there we were trained into how seniors are contributors and not the takers, right? So basically, this is something which is very important here, and I'm trying to highlight these things that I have been working for the past 15 years to let seniors contribute into the system. And my initiative, Senior Express, was exclusively looking into provision of such programs and services. Moving on to the second action point, which is age-friendly environment, and the focus is on designing for dignity. So now we see many open parks are there, and many open gyms are there for seniors. This is a good example of age-friendly environments where the focus is on safe mobility. That is, the transportation accessibility should be there, well-lit street should be there, there's a proper way to walk, ramp should be there. Even lift should be there in all the buildings. These are some cases, some examples of age-friendly environment. And the social inclusion in terms of community space, cultural programs, and how all these things can be promoted. And integrated support is about healthcare systems that basically coordinate across providers in terms of providing, as I said, the age friendly environment is not just physical environment but the psychosocial environment as well. So there should be an integrated support from the psychologists, from the social workers, from the policy makers in terms of ensuring that the environments are elder friendly and the senior citizens can live with dignity in such environments. Then is the third action area, which is the integrated care for older people. And the World Health Organization, through its ICOPE program, is doing a great work in terms of integrated care for older people. And you can see the framework here, that how they can work on their how the early stage of declining capacity can be diagnosed and intervention can be done on right time, so that the mobility, depressive symptoms, things can be taken care of and a senior can be made to live with active and dignified life. So the health here, the integrated care for older adults, the mental health is very important. Like depression, anxiety, and cognitive concerns are some very major concerns. And when we talk about integrated care, we must include mental health screenings, counseling, care support, caregiving support, and a burnout, because most of the caregivers often experience burnout syndromes. So the burnout should also be controlled. So the mental health is very essential thing, and there the role of we as psychologists is very essential. And my area of neuropsychology basically looks into provision of such services. Moving into the fourth action area, which is the long-term care systems. And here, if we can see, the a caregiving ecosystem is very important. And how is it important? Because now more number of older adults are living longer, and they need more support, both physical, psychological, social. And for that, as we see that traditionally these kind of supports were provided by family, but now with more number of women in the who were initially the primary caregivers are now into workforce participation, and there is also geographical separations of young family members in different parts of world or countries for better job prospects or studies. So then in that case, the caregiving, long-term caregiving becomes a major concern. So in such kind of situation, there is a need for trained workforce, there's a need for assisted living options, there's a need for respite care services and dignified services, which is basically focusing on more psychosocial activities. So these are some of the action which are being provided by the government and the voluntary organizations and for-profit organizations in terms of the long-term care systems. Moving further, these are some of the, from the government point of view and from the Indian point of view, these are some major government and national level initiatives which have been taken to promote UN Decade of Healthy Aging. And among them, National Program for Health Care of Elderly or Ayushman Bharat or Digital Health Ecosystems, even the Elder Line, which is there, and national policy on older persons, even smart cities are being focused on. We are talking about smart cities are coming up in India. That is also focusing on age-friendly initiatives like barrier-free zones, open spaces, more gyms, open gyms, or walking spaces, and maintenance and welfare of parents and senior citizens act. Even the National Social Assistance Program, which is provided to below poverty line senior citizens, which is Indira Gandhi National Old Age Pension Scheme or Indira Gandhi National Widow Pension Scheme. These are also some of the initiatives to promote UN Decade of Healthy Aging in India. Even the longitudinal aging study in India, that is the LASI, which is the largest aging study in India, is also providing lot many information about healthy aging policies and digital literacy initiatives by Indian government like Digital India is also on the is also working on promotion of healthy aging in a broader way. So these are some of the government initiatives and some other national level initiatives by for-profit venture, even NGOs and academicians like us, policymakers are also working in this area to promote this particular concern. And so, what is the focus I'm trying to emphasize? And as a psychologist, how I say that healthy aging can be promoted. There are certain pathways to thrive, and there is so focus should be on functional ability, physical exercises, nutritional diet, and healthcare is very important. Independence is very important at this point of time. Cognitive and social engagement is very essential. Like people can go for book readings. They are going for. So I worked in one organization where we used to have chai masti sessions. So these are some examples of cognitive and social engagement. Emotional well-being is also very important. Mindfulness and counseling services, supportive relationships, like providing some kind of companionship services. These are also very important way of promoting healthy aging. And digital companionship is also something which is very essential, which is actually also a part of most of my intergenerational programs are focusing on digital companionship, where the youngsters are teaching seniors as to how they can make use of the smartphones or laptops or iPads and many other apps as well. So these are some ways to thrive and to promote healthy aging among seniors. And on this note, uh, I would like to thank you all for your patience. And I would like to end my session with the saying, as with what Jayasurya started, that healthy aging is about adding life to years and not just years to life. Thank you very much for your patient listening. This session is open now for all the questions and answers. Please feel free to ask your questions. I'll stop sharing.
Thank you, Dr. Nidhi Misra.
Yes.
I'm also one of the volunteers of this NIMHANS. So,
Yes.
what I like to say is that, see, You have enumerated all the steps being taken by the government in regard to implementation of this healthy aging policies in India. How
Yes.
far in your experience, as you have been doing a research on this, how far in your experience these initiatives have reached the socially disadvantaged sections of the society, Doctor?
Yeah, when we talk about the socially disadvantaged section of the society, as I mentioned to you about Indira Gandhi National Old Age Pension Scheme and Widow Pension Scheme, even Maintenance of Parents and Senior Citizens Act also do come under this initiative. And let me tell you, I was a part of this United Nations Population Fund project, which was about building knowledge base on aging in India. It was one of its kind project in India. In fact, one of the first to be done in the area of aging. And I was a part of Tata Institute of Social Sciences, and we did researched and tried to find out how are these schemes and policies working for seniors who are below poverty line. And yes, there was some lack of awareness among them, but to a large extent, they are utilizing such schemes. In fact, Maintenance of Parents and Senior Citizens Act is something which many police stations are creating good awareness about it among the senior citizens or senior citizen associations. So I feel it's a combined, as United Nations says, it's a combined effort, right? We all have to come together. So I, as an academician or policymaker, I have to join hand with the local NGOs. And in fact, we are running a program. We have developed some programs on capacity building for digital literacy of senior citizens. So we are working with youngsters who are in school and colleges. In fact, I do run a program. I do run a course on health and aging, and I do train my students to go and conduct workshops and sessions for the seniors, especially the one which about whom you were saying, the economically disadvantaged section of the society. So they are going to these old age homes which are often having destitute senior citizens, and we are also planning to do something with the with the police stations in terms of the digital literacy of these people.
Oh, thank you, thank you. So therefore, you are saying that okay, these schemes have, reached the intended beneficiaries to a large extent.
Yes.
Although there are certain gaps, there are certain gaps. But
Yes.
I tell you, I have been also working with this the Parents and Senior Citizens Act for another organization. I also worked for this Mobility International with regard to this. And very recently I attended one Healthy Aging in India workshop. That is, that was conducted in conjunction with this University of Edinburgh. It was done by the Institute for Social and Economic Change, Bangalore. So, in fact, there were lots of concerns expressed in that webinar. See that, many of the senior citizens felt that, okay, sir, see, the environment in which we live is, not very, eco-friendly for these senior citizens. And again, there are lots of discrimination based on this age. Okay, I only wish that, as you rightly pointed out, that over a period of time we are able to create some kind of awareness amongst our seniors, and let us also establish our rights. See what happens, once you give up easily, then people also will try to run over. Therefore, we also express. And only one small concern I would like to add here, madam, is that the aging. When does aging actually start? Aging starts right from the birth.
Yes.
So you cannot, even before the birth, I should say. So we cannot be talking of healthy aging only to people who are above 60 years. See, this 60 is a number that government has stipulated to determine that who is a senior. But to be very honest, this healthy aging concept should start at 40 years. So that, see, this is the time that people turn slightly gray, the hair straight, and they need to wear a glass for reading purposes. And they also, they are also settled in life to a large extent. And that is the time that they have to think of their health. And if they start thinking of at that time, and again, they'll have to also create lot of reserves for their existence beyond 60 years when they are not going to earn anymore. when they are not going to see, because in many jobs today you don't have pension, and in the over a coming period, I think you will have to depend on your own income or your own investment income. So in that, probably it will be a good idea if we can start talking about this healthy aging to the people who are above 40 years. That is my only submission. And my last question is that geophysics, I mean, you are talking about that. What exactly is that?
Sorry, I didn't get it.
Geophysics, your specialization.
I said it's geropsychology, sir.
Geopsychology, yeah.
Yes.
Yeah.
It's a specialization within psychology, which is about study of old age.
Okay, okay.
Yeah.
Okay, thank you, ma'am.
Neuropsychology is a specialization within that. And if I may just add to your point, as you rightly said, 40 years. In fact, I would say not just 40 years. Why not start at 20 years only?
Exactly.
Because the right financial planning or physical health, so anything which is there, any fitness, a person doesn't become active all of a sudden. It all starts with the active lifestyle from the young age only. So I think what you are saying is right. It should be taught even in the schools how to be active, right? From there only it will start.
Exactly. I agree with you, but why I put that 40 years is that at least at that time, I think people reach a stage of life where they have to see a large extent settle. That is why I fit to that 40 years. And then Mr. Tangaraj wanted to raise his hand. Sir, you can go ahead, sir. You can go ahead.
But good evening, Doctor.
Good evening, sir.
Now, as you said, government is planning for senior citizens by sanctioning old age pension that is bigger amount, 1,000, 1,200, like that. Some states are 2,000. Various states are not uniform. The amount has to be raised by union government so that state government can follow the same. The price is a very high trend. They are not able to cope up with the amount sanctioned by the government. Our organization should send proposals like that. In Tamil Nadu, above 70 years, people are getting free food grains at the doorsteps. For the past 6 months, they are giving senior citizens, providing essential commodities through fair price shops. This is one thing. Then employees, as Mr. Jambanathan said, employees provident fund at union level, they are fighting for at least 9,000 per month for all employees who are having no pension in government and government undertaking like that. Lastly, one thing, as he was telling about poverty, below poverty people. Nowadays, the Act has provided one home for one revenue district, but not coming up in letter and spirit in almost all India or in other states also. Some private parties are engaging old age homes. There are three categories: A, with all facilities, huge amount per month; B, moderate amount, not fully usable, like food and shelter, bathroom, toilet, as a hygiene, like that. And the C category is only with the help of donations from the philanthropist, and they are running the home with least facilities. Therefore, the Act says every district has to be built with adequate facilities in a spacious manner, and provide food, shelter, and hobbies, and mingle with social activities like that. Thus, this is even the 2007, the Act has been passed and rules have been framed 2009 onwards. But the government is reluctant to construct the old age homes in all districts. We are also pressing in various through various associations. As you said, associations is important for senior citizens, not only pensioners. The general in public, they have to form BPL people have to form an association, and we have to recommend for their better livelihood and healthy aging. That's why. Thank you, doctor.
Thank you, sir, for your points.
Visha Singh. Visha Singh has raised hand.
Yeah.
Can you please come up?
Yeah, so
Yeah.
good evening, ma'am. I'm actually an MPhil clinical psychology trainee present.
Can you just switch on your video, ma'am?
1 second.
Yeah.
Am I visible?
Yeah, welcome. Now you are visible. Beautiful.
Yeah. So I just had like a two-part question. Since like I'm in training, I was wondering what is the effectiveness of training and current practices in clinical psychology or psychologies across to manage and deal with geriatric problems that come up in our country, because I had been reading quite a lot on geriatric psychology and geropsychology, and there's a lot of material from abroad, but there is sort of scarcity of material currently. And like, how prepared are we to deal with the recent problems that have with the problems that have been coming up with the changes that are coming? And what are some areas that you think would will really benefit from the involvement of psychologists when it comes to geriatric care?
Thank you, Trisha. I think as a clinical psychologist, something which is very important for you is the dementia care, right? So dementia care is still a big challenge in India, though many of us are working in this area, but still we need more clinical psychologists and psychiatrists to contribute in this area, especially in terms of the long-term care, because this kind of condition needs a long-term care, and even the caregivers well-being is also very important at that point of time. So when a clinical psychologist or a psychiatrist is working, I mean, specifically I'll say clinical psychologist is working with a dementia patient, they also have to look into the well-being of the caregivers as well. So that is one area I would suggest where a lot of work is required, still required, though we have people working in this area. Another thing which you are mentioning, like you don't see much work in this, no, it's definitely gerontology is something which is still a very growing field in India. And imagine 12 years back when I started my work, or I mean almost 20 years back, if I may say, hardly there was anything in this area. And another thing I feel a psychologist can work where I am particularly working on is the intergenerational bonding and relationship. Many of these concerns can be dealt with if we just sensitize or create awareness among a younger generation about these issues. And as I said, you go across, hardly you will find universities, very few universities on your fingertip you can see in India offering programs for aging, right? So as I said, we are one of the universities, Geetam is one of the universities which has designed a program on health and aging. And I do train my students about long-term care, end of life care. Nobody talks about end of life care, right? To live with dignity and to die with dignity. How many people are talking about it? How many people are talking about the life will, right? So let's look into these aspects as well. Because and one of my students, she asked me in the last class, I remember, she said, ma'am, when our grandparents talk to us that when we will not be there, how you will feel and all that. And we often ignore such talks. After your class about end of life care, I feel this is such a pertinent topic to talk to them about, right? So I think this is the way in which we have to look into some of the more indigenous topics. I would also suggest, please don't compare. I am actually working on many cross cultural research. I have worked in one of the research project where there were 13 countries working together on this topic, but I'll say many indigenous topics we have to look into in the Indian context. So please look into some of the more culture specific topics. And I found some of these are these topics which I mentioned to you. Right? India has culturally also we have this system of building bonds between generations. So why not take it forward? Yeah. I hope I answered your question, Twisha.
Yeah, thank you so much, ma'am. Actually, I was looking for a more indigenously accurate answer because I actually have to give a seminar on geriatric healthcare and mental health care, and I was finding it a little difficult to take those Western models and sort of like apply it to cases that we are getting in our hospital currently. So, like, if you
So
could,
one of my paper is on positive caregiving.
yeah.
And you see, most of the papers most of the people talk about burnouts in caregiving. But I have spoken about positive aspects of caregiving because, as you say, indigenous system, indigenously we connect caregiving to seva, dharma, right? Those indigenous aspects I have applied here. I have also looked into the Western model of Parma. So I have tried to combine Parma with the indigenous seva and dharma model and came up with the positive caregiving. Maybe it will be of help to you. And you can connect with me later as well.
All right. Thank you so much, ma'am.
Thank you. Before I ask Mr. Ganesh to raise a question, you have been talking about some senior express.
Yes, sir.
Can you just throw some more light on this?
Yeah, Senior Express was an initiative I started around 10 years back about sharing positive aspects of, stories about seniors who are leading an active and productive life in India. And also used to conduct workshops and programs about sensitizing children in school and youths in colleges about healthy and productive aging and building and also I used to conduct some training programs, some kind of projects where seniors and youngsters used to be doing things together. So the Senior Express was an initiative in that way.
But does it continue even today, or it was a fixed time experiment?
Yeah, no. It is still continuing. I am continuing it through my volunteers, my students, and my other volunteers who are working with me.
Yeah. If you can just give us some kind of a lead for that.
Yes.
Some of us can also connect with you.
Sure. We can connect on this. I will connect with you after this session about that.
Welcome, doctor. Welcome, doctor. And Mr. Ganesh has raised a hand. Ganesh, sir, you can now talk. Unmute yourself and talk, sir.
Yeah. Good evening.
Yes, sir. Good evening.
Yeah. Actually, I want first. I just wanted to say about. Do you aware that is there any guidelines or policies for this old age home, senior citizen home, retirement home? Each in India, it is talked in a little different way. If it is old age home, people take it like they are destitute, they need some assisted living or something like that. Old age homes and all that in Coimbatore and many areas, it is fully commercially created where people afford and going about. Is there any policy around in India? If not, being you are in the policy making, can you recommend government to have a policy on this, like guidelines, minimum guidelines, and they are not supposed to be too much commercial, and there should be some caps on the prices and all that. One. The second question is, can you compare this same old age home or senior citizen homes and all that with Western world, if you have come across with that? These are all two questions, madam. Thank you.
Yeah. So thank you for your question, sir. Let me just clarify one thing because I have also worked extensively on the different type of settings for senior citizens. And one of them is the retirement community, which has come somewhere from the Western world. But if you see in most of the metropolitan cities, it's a very popular thing. So I have stayed in Pune, I've stayed in Mumbai, I've seen many of the seniors staying in retirement communities. And often people think that retirement communities are old age home. They are not old age home. These are some kind of setup where the seniors willingly are part of, are buying that property, they are living there. So every retirement community has a different set of procedure. Like some say you can't transfer it to your family. After you are gone, that will be coming back, and some whatever deposits they had, that will go to family. So there are different set of things happening. So one of that is we need to clarify that these are retirement communities, and that the other set is old age home. Now within old age home also there are paid old age homes, where many times in Pune I have seen one very big old age home where many seniors were willingly staying there because their children have migrated to other cities or countries and they don't want to go to those places. They want to be in their own cities, but alone they can't stay. So they've decided, okay, I'll be here and be taken care by somebody. And even the family is confident about it. Okay, somebody is taking care of them. There are some other set of old age homes which are for the destitutes, the ones who can't pay anything and they have been just literally thrown out of the family, abandoned by their family members. They are found on streets. So they are different set of living spaces for seniors. So one thing is this: we need to clarify about this. Are we talking about the retirement communities or the paid old age homes? One thing is this. Another thing, sir, the policy which we have, the national policy for senior citizens, do talk about such schemes. What kind of set of procedures are there, guidelines are there. But as I have said earlier, also the programs and policies are there. But people are sometimes misusing these things as well. But let me tell you, there are people working in this community. I know some of them who are actively working on setting up a procedure, a guideline. Even a couple of years back, I was also working with Senior Citizen Association in Hyderabad, and we were trying to come up with some guidelines for old age homes. But to some, we started with it, but something got disrupted in between, and we couldn't finish it. But if you want, I can share those information with you. I know some people right now are currently working on
Yes,
coming up.
yes, madam. You give your references. I wish to know, and I am looking for. So definitely there should be a clear-cut policy decision should be from the government side. Actually,
Yes, it
being
is
your
there.
yeah,
Yeah, it is there.
it should be
But the
strictly
thing is,
implemented.
awareness.
Maybe implementation is having
Yes.
its own issues.
Awareness is also important, sir.
Yeah, yeah, yeah.
People are not getting themselves educated. All of these things, the Ministry of Social Justice and Empowerment have most of the things they are highlighting about the schemes and policies for senior citizens. Even if you go on website, you will get all these details very clearly. And when I was working with TISS, I have actually worked on compiling all the schemes, programs, even sir was saying earlier about state-specific programs and scheme. Yes, there are state-specific programs and
Okay.
scheme in addition to the central policies.
Oh, thank you.
Yeah.
I mean, from your slide, I could note down few site references. I will definitely go through that.
Yeah.
How is it? I mean, to complete, how is it compared with the overseas, like same policy level, or how in maybe something like you can compare with Australia or Switzerland or
Okay, I'll just
Singapore, things like that. Actually,
yes, yes. I would say one of the European country I've been to, and we were made to visit the retirement, the assisted living facility there. And when I asked their in charge about, as you saying that no, the other countries might not be facing such issues, so I asked them out of curiosity as a young psychologist that how about the elder abuse cases? What kind of cases do you find here? And you will be shocked to know there are not just physical abuses, there are sexual abuses too. So it's not that no, it is not happening anywhere else. It is just the responsibility of the organization, the people, the family, the seniors themselves to be aware of what is happening with them. Right?
Thank you.
Yes, doctor. I mean, doctor, I can share at least one information in that the latest information on this is that at least Maharashtra government, they have involved the RERA agency, and they have given certain guidelines for establishment of senior citizen homes.
Yes.
I mean, as far as I know, only this state government has given some kind of a guidelines. Even that, it's a very, very broad guideline. So it can be interpreted in more than one ways. See, the biggest problem we face is that whenever some government comes with something, then it is getting interpreted in so many different ways, and ultimately the benefit doesn't come to the as desired. Thank you, sir. Thank you. And Mr. Ramnath has raised hand. Ramnath, can you unmute and ask your question?
Hello.
Yeah.
Hello.
Please.
Hello. Hearing?
Yeah,
Hello. Actually, what is the topic? I am doing the physio exercise. In between, I am just talking. What is this thing? Today's program, sir?
Today's program, okay. Today's program is about aging.
Aging. Okay, thank you. Madam, I am Ramnath, 78 years, staying in Chennai. I am having the sciatica problem for the last 10 years. I am doing physio exercise and yoga exercise, other thing. Is it be cured by Reiki or your other things, or acupuncture, acupressure like that? For 10 years, I am suffering walking difficulties on right leg. Sciatica. I had C4, C4 operations 10 years back. Still, I am in difficulty in walking. What to do, madam? Please.
Sir, actually, I am not a medical doctor.
No,
I think
okay.
it has to be proper diagnosed to see what
Okay.
exactly is the problem. Then
Okay.
accordingly, a decision can be taken. So definitely, as you are saying, let me also, I think you are raising one concern, which I also need to highlight.
Okay.
In fact, Jambunathan sir was asking about Senior Express, sir.
Yes,
There are many stories which I have shared, and that
Mm.
one story was really touching to me because this was about a gentleman who was a lawyer by
Okay.
profession, and he was in his 70s at that time when I met him, and he was complaining of some respiratory health issues. What
Acha.
happened? He
Okay.
was meeting different doctors and trying to find out how he can get rid of these things, but it was not going. So, out
Okay.
of his curiosity and persistence to resolve this issue, he went to yoga, right?
Okay.
And I think this is very important for Twisha also because she asked for some indigenous practices and issues,
Okay.
concerns.
Okay.
So he went into the background of what yoga is, how it can be useful, what are the indigenous programs and services,
Okay.
and you
Okay.
won't believe he not only just read about it and he implemented many of these yogic practices, and
Okay.
not only just he resolved his own respiratory health issues, but he was also called as an expert by many medical
Yes. Main
institutions.
yoga is pranayama and this thing.
Yes, so he was doing Neti Kriya and all those things.
Okay.
So he actually started going as a trainer to many of the
Okay.
organizations
Okay.
to train the other people about this kind of issues. So this is
Okay.
something which this was a very striking thing in my mind
This
that
is very yes.
he
It's a
was
very
a lawyer.
unique issue.
Yeah.
Correct.
He was a lawyer and he learned to
Uh,
solve his issue and then he started helping others. And sir,
Very
this
good.
is a clear example of seniors as contributors, which
Okay.
Made in International Plan of Action talks about and which even our policy on senior citizens talks about.
Thank you, madam. Very nice, madam. Thank you very much. You good name, madam?
My name is Nidhi.
Where is he? Okay. Okay. Thank you. Thank you, Jamunathan.
Thank you. Sir, Doctor, sorry I am interfering again. See, in fact, the experience you have been talking about, we have got in our own society, in our own setup, there is one, I will even take his name, one Mr. Nagaraj Rao. He was the managing director of this Silk Board in Bangalore. And I thought he was a very good tennis player. So he had some kind of issues because of his tennis play, and he started doing pranayama, etc., etc. And from the age of 65, he started develop. Today he is 86, and he is teaching pranayama to all others. And in fact, he also did one session with us. Not one session, but I am also his follower in the sense that I also attend his pranayama classes. Therefore, there are many occasions when seniors have become contributors. That is why I wanted to know about this Senior Express initiative, so that I think there is no end. There is no light. There is light at the end of the tunnel. I wouldn't say that there is no light at the end of the tunnel. There is light at the end of the tunnel, and only thing is we need to pursue this. So that's why Dr. Nidhi Misra. It was a wonderful lecture, and it's a very, very practical one. I wouldn't say even a lecture because that will be only theoretical. It was very practical in the sense that you have analyzed things as it is. And yes, you have come out with some solutions, you have tried those solutions, and you are continuously working on the solutions, and you are teaching your people on that also. In fact, you mentioned something about geriatrics. You know, even today, how many hospitals have got geriatrics department? There's not many. Only
Yes.
a limited number of hospitals. Even those hospitals which have the geriatrics, they say some leading hospitals, sir, we have got geriatrics department in only one unit, not in all the units. That is the kind of situation. But probably over a period of time, I think if this birth rate continues, almost most of these hospitals will be, the nursing homes will be converted into geriatric hospitals. Because that's
Right.
the way in which things are happening. Because 2050 and the numbers that you are projecting is something, I mean, people can't understand, visualize that. Thank you very much, sir. Thank you very much, doctor. I mean, God bless you. God bless
Thank you, sir. Thank you, sir.
This
Thank you,
is-
everyone, for your active listening and participation. It really made my day. Thank you very much.
You are the real beneficiary, doctor.
Thank you.
Thank you,
madam.
sir.
Thank you so much, ma'am, for the insightful session. It was a really most experiential learning for me also here. Thank you so much for the insightful session, ma'am. Thank you.
Yes. And why only request is that please talk about this to the youngsters. Because youngsters, it is they who need to learn. And you know, they are going to be the elders of tomorrow. That's it. Thank you. Thank
Sir,
you.
I am exclusively working with youngsters. Let me tell you, I'm even training my students, and you won't believe my first batch of students for whom I designed this course, Aging and Health. One of the assignment was to go to old age home, meet the residents there, and design some psychological activities for them. And you won't believe all my students went there, and they not only met them, but they went back again to conduct some psychological training programs for them. And the second batch is I'm having now. We are also planning to do one more health camp with them.
But you do all the experiments only at higher.
Anyway, field visit is very important. Only conduct of meetings and expressing our views. That's one thing. Other than that, we have to visit the people and say something about their wellness, healthy aging. Practically, field work is very, very important. We are doing in our association as well as visiting homes in some remember days, birthdays, like that. We are associated with them. We are contributing the food and other things like that. That is the main thing is very important nowadays because affordable person has to give some.
Sir, Mr. Maharaj Rao has come. I think I was to whom I was talking about him. I think if you want to add something, please, sir, please. Sir, you are muted. Sir, you are muted. Please unmute yourself. Sir, you are unmute, sir.
Unmuted now.
Yeah. Now you yeah.
Dr. Nidhi, I am Nagaraj Rao.
Namaste, sir.
Sorry.
No problem, sir.
Jamunathan was telling about me. Thanks so much, Jamunathan, for having given so much of certificate to me. And I am following yoga, specifically breathing. I'm going to different old age homes to advise them how to do deep breathing. That's my assignment now. I have already finished about 2 or 3, and I'll go for some more organizations. And I have obtained a lot of benefits from deep breathing. And I have already been telling my friends, colleagues about it in my pranayama group. I am 88 years young, no problem of sugar or BP, but I have arthritis which I developed because of my tennis. Could be, but no regrets. But still, I am managing it without much of a problem, and I'm still doing every day. I don't say pranayama because pranayama is a big word to be used. I say deep breathing. It still becomes pranayama, meditation, everything. It results in that because meditation and pranayama do require the breathing as the starting point. That's all my input, doctor.
Thank you,
Glad
sir.
to know about you, sir. And I would definitely like to connect with you later to know more about you.
Doctor, I'm not able to hear you.
No, sir, your thing is closed, sir. Sir, probably your sir, I am listening, sir. I'll just tell you, sir. Don't bother.
Okay. Right. Now it's okay. It's okay.
Please tell me, madam. 1 second, please tell.
Yes, sir, I am saying it's an honor to meet you, sir. And good to know about you. I would definitely like to connect with you later because you are somebody whom I would really like to connect and know more about yourself.
Sure, madam. Jammunathan is a gem.
No, see, sir, I have become a gem because of you. That's all I can say.
Oh, no. Anyway, Dr. Nidhi, I heard you.
Sir, already, sir, we have overshot the time. Doctor must be a busy doctor, busy, just a teacher. Therefore, let us not disturb her too much, sir.
No, sir, I have also shared my email ID in the chat box. If anyone would like to connect and would like to have more questions or inquiries, I can connect later as well.
Yeah, you can. You have given this mmishra@gmail.
Yes.
Geetam.edu.
Yes, sir.
It's an institutional email ID, not Gmail.
Yeah, it's an institutional email ID. Yeah,
Yes.
just 1 second, madam. I'll just note down. NMNMMISHRA. Okay. I'll just take a photo. Thank you, doctor. Thank you. It helps. Thank you very much. Much obliged for all. See, you have spent so much of time with us.